So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Doctoroncall, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this will actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management, where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online. So the patient can get treated a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Doctoroncall platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy.
Hi everyone, welcome to our special session. Today I'm here with Encik Hazwan Najib, the co-founder and chief marketing officer of Doctors on Call. Doctors on Call is an online platform that launched in 2017, and they're aimed at improving the waiting times and availability of healthcare anytime, as you have seen from the video, anywhere to everyone without compromising the quality and affordability. So remember that, because we'll be talking about it later. And they are Malaysia's first online video consultation platform that combines advanced video and voice technologies with their medical knowledge and experience of Malaysia's top doctors, and they currently have an average of active users of 800,000 visitors a month. So this company started out, was ideated in 2016 and started out in 2017. And in a month, they first had 10,000 visitors, but then it grew to 1 million. So we are here with one of the men who made it possible for this to happen. This is Encik Hazwan Najib.
Thank you, Myra, for having me. I'm glad to be here.
Yeah, no worries. So let's just dive in on the chat, right? Or perhaps you can tell us a little bit more about Doctors on Call, if the video or if I've missed anything in my introduction.
Okay. Thank you. My name is Hazwan. We started Doctoroncall back in 2016, so it's been slightly over 5 years. We started, we tested, and then we properly launched the platform in early 2017. Initially, what we were trying to do is just to close the gap of providing an alternative channel to get help or to get medical advice, right? So if you notice, a lot of people started Googling on healthcare matters. What the doctors has been advising is to not Google or not self-medicate, right?
Yeah.
But there's no halfway channel between Googling and taking your time off and go to the clinic.
Yes, no, I cannot tell you the amount of times that I have Googled one symptom and I've come and WebMD told me that I had cancer.
Yeah, so those are the kind of thing that you don't want to do self-diagnosis. And then sometimes you're very busy. Sometimes that headache that you have had, you keep taking, say for example, taking Panadol. But you should actually ask a medical professional what you should do, right? You know, they will be able to assess how long have you had it, whether which part of your head that you have the headache, and so on. I myself is not a doctor, so I won't be diving into it, but I'm just talking about experience and some of the sharing that has been done by our doctors,
yes.
right? And rather than you delaying, 6 months later only when you want to go, you might as well get a quick advice conveniently through online platform. Then you do what's necessary in terms of going for the subsequent treatment, screening, x-rays, and so on.
Yes, thank you about that. Actually, we want to talk a little bit about accessibility soon. But before we move on to that, you mentioned that you're not a doctor, right? So,
yes.
Encik Hazwan Najib actually came from the banking industry, consultation for about 10 years, and then decided in 2016 to pivot into the healthcare industry. So, I want to ask you a question, this question on why? Why did you decide to move into the healthcare industry from banking, of all professions?
Yeah, so if you see in other industries, especially in banking, and that's true, I've never touched healthcare industry in my life professionally, right? In banking industry, you've seen a lot of evolution of technology. Maybe 30 years ago, there's only bank branch, and then they introduced ATM, and then phone banking, and then internet banking, and then now it's mobile banking. I mean, when was the last time you went to a bank branch anyway? Right?
No, the only time that I ever take money out is when I have to pay for my parking ticket.
Right. Even ATM, rarely you visit ATM. So you see how the industry has evolved. But when it comes to healthcare, I had my first child in 2015, and then it has a hypochondriac parents. Every single thing I want to ask my pediatrician, and I feel bad about WhatsApp. He did give me his WhatsApp number, but I just feel so bad to just keep WhatsApping, right? And
all the doctors out there,
right? And we also don't want to be that parent who just keep rushing to the hospital every week, right? For whatever reason, right? So. And I don't mind, paying for that service, right? So I thought, okay, maybe we could have a platform where it's more convenient for doctors and patients, and doctors might have their free time or in between consults or in between surgeries and all, that they can talk to patients in a proper manner, and a platform that they can actually record the clinical notes and so on, so that it's not just a WhatsApp conversation, right? So that's how Doctoroncall was born.
Yeah. Thank you. Yeah, also because you had a lot of experience in the banking industry of transforming, brick and mortar banks, right, into a digital space. So how would you say that affected or influenced the way that you worked on the Doctor on Call platform?
For healthcare industry, what I notice is a lot of system or the whole industry is designed
from the professional point of view. So a lot, okay, this is what the doctor can do, and this is how the process and the experience should be. But for many industries, they have moved from the organization-centric view to a customer-centric view.
Yes.
And for me, because I'm not a doctor, I've always, I will only be a patient, right? So I try to create a platform where, okay, I want to introduce something that makes sense and convenient for the patients, right? So sometimes as a customer, I'm not sick, but I want to ask this a few things with the from the doctors. I need a professional advice. I don't need treatment, right? So what if I have this platform where I can just ask rather than just googling and or self-diagnosing and whatnot, and have this platform where I can ask, and for any basic, if the doctors say that, oh, okay, actually for that red eye of yours, I can give you this cream or this ointment, then he can prescribe, and the medication can then be delivered to the house.
Yeah, that's actually a really interesting topic as well, because healthcare doesn't just compass when you're sick, right? Sometimes you have like that backache that's been in your back for like a year, 2 years, you know, you have a twitching eye and you're like, it's not enough for you to get off work, right? Or because you can still function, but it's still a healthcare concern.
Correct.
So I guess this platform does fill in that gap in the market that allows you to ask for consultations.
That's correct.
Yeah.
In fact, one of the early users of this platform are a lot of female who are looking for more on women's health matters. They have, say for instance, like irregular menstruation, something that, okay, they have been having it, but then it doesn't, you know, they're busy working, and or they have, like, you know, a child at home that they can't just leave to go to a medical clinic to just ask about their irregularities. So they just live with it for a while until, like, sometime it just get too late if there's any more more serious issues. So they find this platform a lot more convenient, a lot more private for them to ask questions, especially those ladies who live in a second tier or smaller town, or even in kampong, right? We in KL typically, like, you know, the urban women are more informed, are more educated on these matters, but not from those outside.
Maybe we can talk a little bit about that. Why do you think that those outside of Kuala Lumpur perhaps do not would prefer to come to your application as opposed to traditional brick and mortar doctors on these issues of like menses and you know, you did mention the issue of, you know, having a child at home, but are there like any societal issues or?
I think if you have lived in a smaller town, I grew up in Kelantan, right? So in the whole district, there's probably only 1 or 2 clinics that the whole family frequented, right? So the doctors knows everyone. We know the doctors and the whole family, right? But there are certain matters that maybe as a man or woman, like you're not comfortable like revealing or discussing. So you want to find another doctor who's probably a bit more distant, right? So they see that, okay, maybe I can try this platform where I can talk to doctors about my private matters, and so that I can seek further treatment. Right. So, and the other thing is not just privacy. The other thing is options. Sometimes you keep going to that same clinic, and the doctors knows you very well. But sometimes you feel like, okay, maybe I want a second opinion, right? Or maybe I just want to speak to a specialist, but I don't want to travel all the way to KL to find this particular specialist, right? Maybe I should try to do the online consult first before I make my way all the way to KL. This similar situation also applicable to people from overseas. About 10% of our customers are from overseas. They're either, for example, Indonesians who wants to speak to a Malaysian doctors for a second opinion, or Malaysians who's living overseas in Europe and the US and want to speak to our specialists back home. The reason being, we are lucky in Malaysia because we actually have direct access to many specialists, especially in KL, right? But those people even in Europe and the US, they have that system where you can't just go and see a specialist, right? So I mean, they follow that you know, primary care and then specialist.
So they have
so
to go to a
access to
GP.
Specialist is very expensive, and it's not easy.
So you have a really good point, and accessibility is one of the issues that we face in Malaysia when it comes to healthcare, right? So for example, even if you have to you have a problem. So this is a personal story, right? So I got a headache, right, that basically numb half my body. And during this time, I was in Seremban, right? And so we went to the Seremban hospital, and then because they didn't have the any free X-ray facilities there, I had to be brought to Kuala Lumpur so that the specialist there with the equipment there was able to, properly diagnose me. And then I was brought back to Seremban, so nicely, like, in the van, like moving around. So like even in on-ground operations, right, we have all these shortages in accessibility, even more so for, and those are for serious cases, right, or cases where you need imaging. In your cases as well, those other issues, healthcare issues also, it's quite fascinating. How did you see this as an opportunity? Like when you first looked into, like, what was your process of digesting this? You came from a customer point of view, but then when you were, because in 2016 you were testing out the market. What were the most interesting things that you found, when you were looking at the healthcare system?
Number one is as I mentioned, healthcare industry is not untouched by technology. A lot of medical records are still kept in files and papers and then kept in a locked cabinet, right? If I go see one clinic, if one medication was given, there's no like continuity in terms of, okay, what's given to you, and see another doctor, so everything else that just starts new. And
your patient history is just
traditionally, the healthcare system have that family doctor concept where it works, right, because you keep going to the same doctors. But unfortunately, in the modern society, people just move around. We are mobile. There's no one clinic that we always go to anyway. We go to a clinic near our house or near our office or somewhere in between, whichever that's open, 24 hours clinic, for instance, right?
That is true.
So that makes the whole life cycle of a patient is a bit more complicated, right? So that's why I think people actually behave in their own, even the whole concept of, if you ask, the whole concept of family, family doctor is great, right? But it's just, if not practiced or it cannot be followed by the modern society. Right, so that's why we see opportunity in terms of the continuity of care on our platform. So for instance, if you use our on-demand GP service, right, you might talk to Dr. A this time around. Dr. A say, okay, I won't give you any medication now. Let's see how it progresses. Or maybe if it doesn't get better, please go to the physical clinic. And then you might have gone to physical, and then next time, like, you call again, and Dr. B will answer and say, oh, actually last time you had this history, but now you have developed into this. Oh, now from headache you develop, vertigo or whatnot, right?
Yeah, usually you only get that if you go to the same clinic.
Right.
Yeah.
Right. And patients tend to get a follow-up advice when it's very convenient, which is online, right? If you go to a clinic, it's very rare that clinic, they will give you, if they give you medication, antibiotic for like 5 days or 7 days, right? No clinic would actually call you back and say, hey, did you get better? Right. No, so we don't call back the patient, but we make sure that we send enough notification to make sure that if there's any problem, we do ask patient for their feedback. Right. If they're happy or not happy with the whole experience. So that the whole closed loop I think is very important. If the
feedback loop.
The feedback loop. Yeah.
That's a very, very good point, because usually, if you go to a clinic typically, right, as you mentioned, because you move around a lot, right? I think urban, I think in the last year, I think 50% of the movements between the movements in Malaysia has been between states, right? Mostly from youths who just graduated and are moving away from other states into Kuala Lumpur. So your address changes. You probably say bye bye, to your family doctor. Even like in the past 2 years, I've lived in 2 different places. I have like 5 different doctors. The one steady doctor will be my mother.
Yes.
The one that gives me all the consultation.
That's great.
Yeah, but cannot lah. You cannot get consultation from your mom lah. That's the one thing.
I think having said that, of course, if you ask, when we first started, there was a lot of rejection, or no one would believe. We were the first one. Someone would believe, right? It's like, but I still want to go to a clinic. But I can just WhatsApp my cousin or my uncle who's a doctor, because for all of us, we always have that one person in the family who's a doctor, which is great. Like, you know, that's fantastic, right? But remember, not everyone has access to that.
Yeah, that's
right.
true.
There are people who actually in the lower income group that may not even have family members who are doctors. And even if you do you really want to discuss your private health matters immediately with someone who knows you?
Do you want to discuss your menstrual issues with your uncle that you see sometimes at Raya? The answer is no.
That's true. Yeah. I heard stories of some people who like travel all the way to go to some distant clinic just to discuss on their, I think it's something about the STDs or
Actually,
people do that.
Yeah, let's talk about that, because earlier you mentioned that some of your doctors were not only women but also members of the LGBTQ community. Could you expand on that?
Okay, I mean we are not like a STD clinic or sex clinic, right? But I think we're serving a lot of general illnesses, serving a lot of our corporates and also insurance clients. But some of the early adopters for this self-paying, so they come to the platform and they pay out of their own pocket, right, for the 20 ringgit consult and then their own medication. Many of them are the one that was seeking privacy. When you're seeking privacy, usually the first thing that you do is you Google, right? Or what is this rash that I have? What is this?
Pray a picture doesn't come up.
Right, but people do Googling extensively, right? And then once they Google, they stumble upon our platform, which they can actually read more. We also have the open forum where people can ask free questions.
Oh, that's amazing.
I mean, we realize that a lot of people actually like to ask those forum questions, and many of them just go and ask in some random forum, which I won't name here, but
okay, it's okay.
you know. so you see all this behavior, right? And then once you actually I can have a phone call or video call with the doctors. Why don't I do that? Right? So it helped them like actually move along in their health seeking treatment. And then if the doctor says, look, I need further testing from you, need to go get this blood test done so that I can diagnose you properly. So the doctors can recommend and also even prescribe the testing that they need. And then they continue with the subsequent follow-ups.
Yeah, that's wonderful, because I think every single doctor takes a Hippocratic oath to do no harm, as well as to ensure that no matter who the person is, that you treat the person, right? And I think with the inherent issues that we have in our society, social taboos, right, surrounding LGBTQ issues, as well as other taboo issues surrounding women's health issues, right? Putting aside all of all of the stigma, all of the societal, all of the legalities of it, right? Let's look at the individual and the people who need healthcare the most. And it's wonderful that we could have this platform, that can actually serve them. And they were the first, in fact, to seek out this platform.
I mean, let me touch on that again. So we, this stigmatized, right? So men, the LGBTQ group, who has health issues. The women with all the basic women's health and also the sexual health issues, right? So they need a platform so that they can comfortably talk to doctors without prejudice or without judgment, right? Unfortunately, we have a lot of those happening in the community, and sometimes some of these matters are not addressed. I mean, if you're a corporate or insured client, right, for some of the sexual matters, they're not covered and so on, right? So you still have to seek your own help, and you also may not want to reveal to your employers that you have all these
no, you don't.
issues, right? So you do your own health seeking treatment, and once you so you can read more. The other gap that we closed was the content itself. Right? If you are English speaker, you Google in English, right? But if you search all this condition in Bahasa, unfortunately, about 3-4 years ago, there's not a lot of Bahasa content. We came, and over the years we have come about 50 or 60,000 articles, videos, and majorities are in Bahasa, because we want to close the gap of this healthcare education content and awareness, right? if we don't fill in this gap, right, the Malay readers would be fed with a lot of product peddlers and
bloggers.
improper health advice and so on.
Yeah.
And you don't want that to happen, because then people start, if you don't have this platform, people start seeking their own, probably buying the black market medication for their conditions, and which makes everything even worse.
Yeah. That's true, because I think there's there's still a culture of traditional medication, which I mean, which is, if you are into traditional medication, I personally have no idea whether it works or not, but scientifically, through the scientific method, there are a lot of these that are not scientifically proven to work, right? They give you no benefits, and sometimes if you have serious issues, and then you go online and then you read all of this information, and then you get the wrong, it will harm you as an individual. So that's actually quite interesting, because when you first started out, you wanted to fill that gap in the market for, to connect doctors with, customers or patients, potential patients, in order for consultation. Why did you decide then, we've talked about the benefits of, filling up that information asymmetry, right, when it comes to the Malay-speaking community and the information available there, right? But what drove you towards creating that content?
I think the idea with online healthcare or digital health platform is, so we need to know, from commercial or business perspective, okay, how do we acquire customers, right? How do we get people to know about our
fill
platform,
that niche market,
right? When you say you launch a website, and some people think, oh, just launch a website and then we just do Facebook, Google marketing and so on. We just pay money, right? And that was that's what we thought will happen as well. Once you pay Google or Facebook ads, your website will just blow, right? It's not, right? You can spend tens, thousands, hundreds of thousands of dollars, but you won't even get 10,000 visitors on a monthly basis, right? So what we did was, actually, look at this. A lot of people, we found this, that 77% of internet users, this is a few years ago, I'm sure now it's 90% of internet users do the Googling first online before they, so 77% is the majority. It also shows how people prefer to get to know, to understand their health condition, issues or illness first before they go and seek medical treatment. Right, but our healthcare system or process, right? You don't have anywhere in between other than you going to the hospitals, emergency, or the clinic to seek health care treatment. So there's no in between. So people are looking for their own ways to do that. So we said that's a big gap, right? We should fill that gap. We should not let people go down this path, right? So that's the biggest gap. So that's why we actually invest in creating content, so that the traffic that comes to our site are more sustainable. They keep coming back for new contents and so on. Right.
Yeah. That's interesting. I mean, I liked how honest this answer was, because I think a lot of people would say to help people and stuff, which might be true as well, right? Which is true. Yeah. But the nature of business that are involved in services that serve society is two things, right? Number one is you also want to serve society, right? You also want to make sure that the needs are met. But second, you also have to make sure that in order to do that people find you. Because if you're doing good things in a silo, right, it's not going to have as much of an impact as you want it to.
Yes,
right?
You'll be the best kept secret.
Yes, the best kept secret.
And the most important thing is you need to make sure that you don't close down after 2 years. I mean, we were a startup, and we don't want to be the 99% of the startup that closed down, right? So we actually power through, make sure that we keep pivoting on the strategy, right? From social media to content to even some people, why don't you just go and open a bazaar? I say, yes, we will do all that, right? And of course, we don't have a lot of money to go on the big billboards and the main media. So we have to find the best marketing dollar for, the best use of our marketing dollar.
Bang for your buck.
Yes.
Well, thank you for being here.
Yes.
Okay, so actually, let's talk a little bit about these challenges that you brought up, right? So you are one of the few startups in Malaysia that has made it past the 3-year mark. right? Because usually that's the most difficult time in a startup's time. So let's talk a little bit about the challenges that you had to face. Because earlier you did mention that, in the beginning there's a lot of hesitancy, right? Because people are so used to going to brick and mortar clinics, right? And let's talk a little bit about how did you overcome that hesitancy towards your product?
Okay. That's correct. When we first started, the first year we only have 2 doctors who are willing to provide service on our platform. It was a challenge because it is new. When you go through whether this is legal or illegal, there's no law. It's a grey areas, right? There was a Telemedicine Act 1997 that was drafted, before the millennium. But it's not relevant because the way people use Google and smartphone, even Google didn't exist in 1997, right? Right. So all those things is there. We created this platform. A lot of hesitancy. We did, and we engaged the authorities, saying that we have this platform, and from the authorities, this is great. I think this is something that will help a lot of people. However, of course, we need to look into how safe this is. We need to evaluate, and we need to change certain laws to enable this. And this is back in 2017. Right. So that was that's a big challenge because you don't have
it's a legal challenge.
Because you can't really scale, right, with all the uncertainty. And but what we did was, okay, we will not like break any law, right? We will try to, but what we do, we try to serve the people, right? Try to get more customers. We make sure that it's almost like self-regulating, right? We don't just oversell or like creating irresponsible content. We make sure that we review our services. We have a lot of if people try to try to say that I want to get some dangerous drugs like Xanax, I said no. So we don't deal with all those dangerous.
Xanax is a controlled medication.
Controlled medications and so on, right? But we also kind of design the whole. We talk to doctors. We say there's no guidelines, or in medical they have this clinical practice guidelines how you manage certain illness where the doctors have to follow, right? But there's no clinical practice guidelines for telehealth, for instance.
That's true,
right? And we don't have that, and I can't go and show like, hi KKM, like, can you come up with a practice guideline for this, because it will take some time, right? But we look at overseas, like in the US, UK, they have some sort of guidelines that we can sort of use as a basis, and we self-regulate. We don't do, for instance, right, when the customer come and talk to doctors on platform, right, that it doesn't mean the doctors have to give the medication or have to give treatment. If the doctors say, hey, look, you're having a chest pain, right? Emergency situation, right? So we didn't deal with emergency as well. You're having a chest pain now. Do you have anyone who can drive you to hospital, or we can get someone to call 911 for you? Give me your address, right? So our doctors, our customer service would go to that extent to help the patient.
It's amazing.
They won't try to treat online, because it's not going to do the patients any justice. But having said, those are the extreme examples. There are some basic things that they can help the patient online, and there are certain things that they can actually help the patient in terms of avoiding further complications, right? So there's a lot of use with all this digital channel, right? I mean, now you've seen all the meetings, even competition, everything is done online. Suddenly everything is possible, right?
Especially after the COVID-19
after COVID-19 pandemic.
Well, during, you're still in it.
Yes, I mean, we've been gaining like a lot of interest over the years. Once we have gathered the customers, we have more doctors who are interested. Right, we have more companies who like to use our platform because they can get a quick, not so expensive platform to get medical advice. So that's how we end up with about 10 insurers and hundreds of companies who are using our service for their members and employees. Right, and we're also like helping the doctors who have like some free time. Some for instance, there are some female doctors who can't do active service because I have a kid and all at home, right? So but I have a few hours extra between 5 to 7 that I can actually come online. yes, come online and help others from the comfort of our home. Then during the pandemic, of course, with the whole lockdown and all, it just the whole need just like emerged, right?
Yeah. Actually, speaking about that, so you started in 2017, right? And last week in Parliament, it was mentioned that over 1,000 contract doctors resigned from 2017 to November of this year, right? And so there's this huge brewing, in fact, Hartal doctor, what's it called?
Hartal doctor contract or something.
Hartal doctor, yes. Hartal doctor contract, yes. These are things that I should know.
Yes.
So Hartal doctor contract, they are planning another, walkout in December, right? So I'm not going to talk to you, ask you about the politics of it, right? Because you are a private company. But what I will ask is, these contract doctors, right? Do you see them finding their way into your business?
I'll answer in two ways. If you look at I think with the contract doctors, I think the government are dealing with some legacy or issues that I think it's not straightforward for them to address.
Yeah.
Right. But from our perspective, right, we when it first started, even now, right. I think there was a period about 2 or 3 years ago where the medical students, they spent 5 years in medical school, came out, and they have to wait. Some of them wait up to 2 years to get into the housemanship, right? To just get started on their medical clinical journey, right? So that 2 years, right? We have a lot of. So what we did was, hey, great, these are smart kids, right? We should actually employ them, get them to be our patient care agent, right? So they are like customer service. But at least, when patient call hotline, they can actually communicate with the patient and the doctor quite well, right? Because they know medical, they can actually summarize whatever the patient. Sometimes the patient just call the hotline and say something, and then the doctor they can actually communicate. So they actually made the best group of medical call center, I would say. And then from then on, we start hiring 3, 5. But I think over the years, I think we have graduated, and then they stayed here for 6 months and they enter the housemanship. So we create this little community of housemen that used to be the alumni of Doctoroncall. Right? I think over the years we have actually about 250 of them have gone through our system. So they did various things. In fact, some of them get into marketing. So they say, once I get into clinical service, I don't have opportunities to learn about digital marketing, SEOs, contents, and so on. So they actually build all these skills while working with us, and then they enter the housemanship, right? And I believe that that's okay. So you see, but then once they go through houseman, they go through all the hustle and bustle of working in the hospital. But unfortunately, that they're still contract doctors. In the last year, we see a lot of resignation. We actually see a lot of requests as well for doctors to join our organization as full-time doctors. We have some opportunities for doctors to kind of move to our platform as in-house doctors. Right? We're hiring them. We're hiring them. Right?
Yeah, you're hiring them.
But I think now with all this digital health, right, there is probably a potential to do. There's probably a potential to do a more proper program as an alternative channel for doctors to practice. Right, so that they are more flexible, they can spend more time with the families and so on. And I think rather than let them, quit medical and then do something else, right, which is a waste of their knowledge, right, they should actually stay in this industry.
Okay. One last question. I think a few more questions. I think you brought up a really good point about that, because the doctors industry is usually very insular because it's very technical, right? So like you mentioned, like 5 years you study, then you wait for those 2 years in order for you to practice, because all of your skills that you learn are skills that are related to medicine.
Yes.
Right. So you're giving them an opportunity to explore other things, and that's amazing.
Yeah.
But in terms of like the contract doctor issue, right? Actually, Later today, I think Dato will join us on the interview through a VMix call. So we have an extra guest today. So there'll be a little spicy. But before, but before that, yeah. So just this question you mentioned. I want to go back to the Telemedicine Act of 1997, right? So the Act says that you need to all the standard stuff. The doctors need to be registered. You need to go through a few. You need to register with the medical council in order to practice. So you went through all of that, right?
Yeah. So we make sure that every doctors who practice on our platform have the valid MMC registration and annual practicing certificate APC, right? And only then we actually activate the account, right? If they do, and every year we do that check. That's a bare minimum requirement. Yeah, we also have some disciplinary issues that we had to offboard the doctors because of patient complaints and of course some serious matters, right? So I think we that's the minimum thing that we do to make sure that that there's a standard, there's quality in our service. But on top of that, right, we do training and we actually work with our doctors to make sure that every single consult that patient go through with us offers a in customer experience studies they call it magical moment, right?
Okay.
Where actually this there's always when you talk to a doctor, it's really helpful, right? But there also sometimes that you talk to doctors, I don't know, doctors just give some general stuff, right? So we need to make sure that the whole experience, that patient actually feels something that
that personal touch,
right? And that's something we discovered. It's actually quite easy to achieve through a virtual call, right? Because the doctors have to ask more questions from the patients, because if you attend physically, sometimes there are instances where doctors may not ask so much question and just look at you and then do the treatment and so on, right? So with through online is more personal, and we need to make sure that the doctors actually provide the kind of standard and expectation that we want.
Yeah. No, that's great. That's great. So so thank you so much for that. Later, maybe we can talk a little bit about how you overcame that challenge, right? So there's already a law that says that you can run the business, right?
Yeah.
But in terms of the day-to-day protocols, that's something that you had to probably develop on your own. But before we move on to that, we do have a special guest with us today. It is Dato' Syamsul Baharin, and he will be joining us very shortly on VMix. Hi, Dato'. How are you?
Hi, Myra. Good morning. Hi, Cik Izwan. Assalamualaikum.
Hi, Dato'. How are you?
Alhamdulillah. How are you?
Very good.
Where are you now, Dato'?
Sorry, Myra, I'm sorry I couldn't join the discussion at the studio. This is due to some very important meeting that I have to attend at Shah. But nevertheless, I'm on break now, so I took the liberty to join for the.
No worries, Dato'. Thank you so much for joining us. Hardworking as ever. So, Dato', do you have any questions for our special guest?
Yes, Izwan. Doctor on call, when I met you for the first time a couple of years ago, when I Google it and I check on your services, things like that, I don't believe so much on Google information. I'd rather speak to you or speak to the principal directly and get the answer from the mouth of the principal rather than the mouth of Google.
Yes.
My question that I have here, I believe that Doctor on call are focusing on city area. Isn't it true or no? I got a second question after you answer this.
Our online platform will receive patients who request for consult with our doctors from nationwide, everywhere, and in fact from overseas, right? Because there's no borders or stopping you from, even if you're in Indonesia or in UK, you can still speak to our doctors. That's the online. However, for medication delivery, we deliver to Malaysia, the whole country, nationwide. For home related services, right now we only concentrated in major cities, KL, Penang, Ipoh, JB, and so on. We are trying to expand to more cities in the future. The other thing is we have the same day or rush medication delivery. That's also only available in the major cities, KL, Penang, JB. Yeah.
I like the services that you are focusing on major city, but will you be considering on the area that not only major city but outskirts? Meaning, I give you an example. Sepang is not in a major city, and we have a lot of residential community, whether they are rich, they are middle income people, they require your services, because going to hospital from Sepang itself or Sungai Pelik, for example, going from Sungai Pelik to a hospital, it will be very far. By the time the patient arrive in the hospital, there's a lot of complication can happen. So are you going to focus on this kind of area? Because I see this kind of area will give you a lot of benefits, a matter of pricing.
Yes, Dato', that's actually a very good point. And we have discussed quite a lot about accessibility. However, we haven't discussed pricing.
Yeah.
So you do have accessibility to people outside of Kuala Lumpur, right? But we haven't really discussed the pricing of it. So how does it? What is it like price-wise for people who are coming to your platform and
For people to get a doctor's advice through online platform is a standard rate of 20 ringgit, right? However, if they are a member of Prudential, some plans for Great Eastern and a few other insurers, they actually can get the consult for free because the insurers giving that as an added benefit. That's one of the work that we did with the insurers. In terms of medication delivery, not an issue. We deliver everywhere, Sepang, Rawang, Langkawi, right? But in terms of home service or even the home testing, the PCR testing and so on, we actually serve Rawang, Sepang, and even extended Klang Valley, right? And we can actually, based on the specific request, we actually we even have served customers in Kuantan before. Those are considered still bigger cities. When I say like smaller cities, I'm talking about maybe Jerteh, Besut, Terengganu, and so on, right? So those areas, maybe we need some time to expand in terms of physical services. I give you one example. There is a patient who needs a hypertension medication in Langkawi, and there's a specific medication that he always buys from the pharmacy. Right? However, the whole of Langkawi that time he cannot find it anywhere. He found us, and we delivered the medication with next day to Langkawi, right? Because he has a prescription, he shared with us, and we double confirm, and okay, and things like that really help the patients to, rather than delaying their medication, and they have actually alternative now.
Yeah, that's actually a really good point, because when it comes to like expanding your business as well as delivery services, we do have to rely quite a lot on the current infrastructure, right, of medication. And in terms of, I think when it comes to medication, there are extra specifications that you need to keep the medication fresh, right? So maybe you can talk a little bit about the challenges of delivering to these smaller towns.
Okay, first of all, we don't do cold chain medication because our infrastructure is very hard for us to guarantee the variability of the medication. We use the services. We of course we make sure that our pharmacies pack the medication properly, and some of the medication it doesn't come from most of the medication, it comes the closest to where the patient is. So the patient in Penang would receive medication from a pharmacy in Bukit Mertajam, for instance, right? So it doesn't go that far, right? And then the pack, we stress a lot on the proper packing and so on. However, things like this is something that the healthcare as an industry should develop moving forward in terms of what's the standards and guidelines for proper medication packaging to end consumer, and if they have a guideline on cold chain, easier for industry players to actually even Big Blue or DHL, right, to enter into and have the proper guidance on medication delivery.
Yeah, that's a good point. And also, you started with the customer-centric approach, right? So why don't we ask Dato'?
Yes, yes.
Hi, yes. So, Doctors on Call, he started as a customer and then he saw this gap in the health industry for what we are doing now, right? And then that's how he introduced it. So I'm going to ask you a wildfire question, right? Dato, for you as a customer, right, what do you want from your healthcare industry services?
Well, if I'm going to answer this question, a lot of people will say I'm a rich man. But in fact, it's not about rich, it's not about affordable or non-affordable. But if I'm going to use Doctor on Call, it is about door-to-door services at my doorstep. From medical treatment, medical checkup, right until medication. Pricing wise, of course, has to be affordable. It should not be any outburst price, which people will think that Doctor on Call will rip off all the customers. In terms of the medication, Doctor on Call must be able to not only focusing on pharmacies that supply the medication, but they also must start talking to clinics, must start talking to hospitals, private hospitals. They must also start talking to government hospitals. Because if you go to, I give you an example, you go to Prince Court, for example, medication are no longer collect from the pharmacies for the second refill. The hospital will automatically deliver the medicine accordingly with the doctor prescription. So if your first time that you go to the hospital and the doctor gives you 2 weeks or 1 month medication stock or quantity, the second month you don't need to call. Automatically they will send to you.
That's a very good
So
point, Dato.
if that can be done, that'd be very good. I heard what Azwan is talking just now about getting advice from doctor, things like that. Getting advice from doctor on call will be very good, or especially on video call. But it will not be 100% perfect as you see the patient face to face. So I would like to suggest Doctor on Call has to send doctors and pharmacists straight to the home. Straight to the home.
Yeah.
Actually, on that note, do we have that service now on the Doctors on Call app?
Yes, we do that. We send doctors and nurses to the house, doctors or nurses for various. It started with, a lot of people wanted to do the home COVID-19 testing. They can send qualified nurses to take the sample. We expanded that to include lab health screening services, where the nurses can come and collect your blood and do a basic health screening. We also have doctors and pediatricians come to the house, for instance, doing the child vaccination, flu shots, and so on, right? So we are moving towards that. However, that all this home service, right, the cost is just getting higher and higher, and only certain segment of the society can afford it, right? So while we are expanding in that, that manner to serve certain people who need those kind of service, but we know a lot of people can't afford it. Just go back to the medication issues, right? Medication can be cheap, can also be expensive. Depends on where you get it and which outlet. So on our platform, we try to give the best to the patient. We try to always get the best source of medication from the partner pharmacies, try to offer, and we are very transparent in terms of the price of the medication, right? In fact, a lot of people are using our medication pricing as a benchmark, right? In terms of lowering the healthcare cost. Right. Just imagine back in the days when you fly, when you take Malaysia Airlines, you have to go to the ticketing office and then get a ticket, and the price you only find out there.
Oh my
When
God,
there's
that's
another,
amazing.
but
That is
then
insane.
when AirAsia started going big on Asia.com online, right?
Yeah.
And suddenly
maknanya,
the price
so
ticket
you
started
baca
to get more
skrip tu,
competitive, where you know it's being pushed down.
Yeah.
Right? So that's one of our initiative to help manage the medical inflation when it comes to medicine and supplies and so on.
Yeah, let's talk about that, like medical inflation, right? So we're talking, so your company is very much towards accessibility and affordability, right? There are external factors that affect, the way that you price your medication. There are regulations, right? So how do you ensure that you provide the best price? Because you did say that it becomes a benchmark. How did that happen? How did you manage to make that happen?
I think
I got to go now.
Oh, okay. Thank you so much, Dato.
Thank you, Dato.
Thank you so much, Dato.
Before I leave you all, you better tell Azwan we can help Dr. On Call to expand their deliveries to rural area nationwide after city and within the city.
Can,
Yes,
definitely.
definitely. Looking forward to.
Okay, thank you.
Dato.
See you all.
Have a good meeting.
Thank you.
All right, so so actually that's a really, really good way. I think you're already planning to expand it anyway to provide those services, right? Yeah, Dato brings up a good point, because I think in today's economy, ever since Grab, became this huge conglomerate that not just gives you, groceries, it's groceries, it's food, not just cabs anymore. People are, especially during the pandemic, right, when they're used to ordering in, people are has gotten acclimated to. Like affordability is another issue, but a larger amount of people have gotten acclimated to having things at their
online.
doorstep. Yeah. So are there any plans to achieve that?
So we are riding on that. One thing that we don't do is, a lot of some disclaim, if you were to buy from the restaurants, is cheaper because, come to the platform, they have to increase the price because of the revenue sharing and so on. But if you look at our items that is selling on our online pharmacy, it is very well priced, it's very competitive. We are just trying to provide, the best we can to people who are used who are getting used to the getting things online in a more convenient manner. There are also children who actually help their parents get medication through our platform with a proper prescription, of course. Right, because they don't have time to say the parents in Kuantan, and they don't have time to go and buy the medication and they help send the medication. And in fact, on our platform, we're talking about one of the widest selection of pharmacy items, right? Because sometimes you go to one outlet, you can't get everything there. You have to go to multiple to find the specific supplies or medicine that you need. Right, on our platform, it's more transparent and easier to find. In fact, our medication are actually among the lowest in the region in terms of pricing. I tell you a story. This before the pandemic. There is
Why is that the case? Why is it that the medication in your platform is of a low price, but then when it goes to a clinic or a hospital, for example, the pricing comes up?
I think it's the industry. I think it's a legacy issues where there's a certain way the medications are priced by the industry. Right, and it was the problem. It was never transparent. Right, transparency brings better benchmarking and better value to the customers. Right, I mean displaying. No one really displaying the price of the air ticket makes drive the whole industry like more affordable. Flying the whole anyone can fly, right? So there's no longer like this secret like I want to go to Maldives and then I have to only find out at the ticketing counter. Right. So same thing here, right? With online, with transparency, only bringing transparency, it will just help actually moderate the whole medication pricing. Right. I think the way hospitals price their medication and so on, I think because they have other cost structures and so on, so it's slightly different.
Yeah, it also depends on the amount that you buy, which supplier that you get from, right?
Yes.
Yeah.
The other thing is this one very good story. There was Indonesian who actually flew into to here because they actually we don't even have sell that. I mean, we don't even have that. We only have the price of that medication. We actually can't sell it. But when he saw that this medication that I am using is half the price here in Malaysia, so it cost him about 8,000 ringgit a month in Indonesia to get it, and here it's about 4,000 ringgit.
Yeah.
Half the price, right? So I'd rather like fly in here, see a doctor, and then like get this medication here, right? So there are all sorts of this like behavior that we discover because it is just the price is not transparent and disparity is there across even worldwide.
Because it's seen as something that is very industry specific, you know, like whatever the clinic tells you, you know, you pay, you know, you also have insurance services that cover, you know, the costs of the medications. I think it's a good point as well. I think transparency does breed a sense of competitiveness, right? Because now the user, in the end of the day, will benefit because the user can now see, oh, this is the price here, this is the price here, make a comparison and decide, right? Yeah. So something that, but your business does it for them. So that's pretty awesome.
But medication is just one small aspect of our business. I mean, we really focus on the whole continuity of care, patient experience, giving them access to medical second opinion, so they can talk to, have options to just talk to multiple doctors from wherever they are. Increasing healthcare coverage, you know, affordable medication, allowing a platform for individuals with more sensitive ailments to come, you know, like you have your vaccinations. So it's a lot of wonderful, wonderful services. So we only have like a few more minutes left, but I think what we can do is perhaps let's look to the future. Right, let's look to the future. So in terms of where you see Doctors on Call being in the next year or 2 years, right? What do you hope, and what services do you hope that you can provide to Malaysians and non-Malaysians? I think in healthcare industry is just very big, especially where the world is, in a way that the country is getting older, right? You know, there are a lot more older people. It's going to be, we're heading towards an aging society, and we also have one of the highest rate of NCDs, diabetic hypertension and heart diseases in the world.
Oh yes.
Right. So that's not giving a good insight into what lies ahead in terms of the healthcare. Just focusing on Malaysia, right? In our country. And that there is a lot of root causes to that, right? It's not just, it's not just the accessibility, it's the whole lifestyle, wellness, the awareness, right? So while here here in KL you have like so much exposure to your friends doing this diet or this wellness program or see this
keto diet
and so on, right? So so a lot of exposure, but there are a lot of people who actually are not exposed to that. You know, they don't realize that maybe eating rice 3 times a day is it may be bad for you, right? If it goes so
because it's a culture to eat.
It's a culture, right? And it's also awareness and education. So with all these gaps, right, we see that in the future we need to see how a platform like Doctoroncall, a digital platform, can close this gap by potentially providing a more preventative care treatment. Not just awareness, but so we are talking about how do we use this platform to make it more convenient for diabetic patients to improve their diabetic illness, right? So rather than they just keep living with diabetics 10 years, keep taking medication for the rest of their life, we want to make sure how we can actually include the other aspects of how can you actually improve on your lifestyle, coaching, and so on, right? So we call that digital therapeutic areas, so that their diabetic gets better and there is a measure of improvement. And we are looking at how we can come up with a model for providers or doctors to be incentivized or focus on getting a good outcome from this each patient, right? So not just giving them treatment, but see whether those treatments and actually improve their long-term conditions, right? So there is a lot of industry component that needs to be moved as a whole, and we keep thinking how we can actually play a role as a digital platform. Because remember, as a digital platform, it's a lot more agile, it's a lot more scalable, and it's a lot more easier to reach to customers. So you don't rely on building one clinic or one hospital, brick and mortar, huge investment and so on.
So you constantly have to be dynamic and change and see what is on with the market.
That's correct. So I mean, just if we accept the fact that in certain part of the countries like potentially Sabah or Sarawak, you will never have the same access of healthcare facilities as what we have in here in KL, right? But we need to see how we can close that gap, right? Because the private hospital may not be building as many hospitals in that part of the country versus what we have here in KL. So that gap, that is impossible to close if you're just thinking in the traditional sense of building a brick and mortar network.
It takes a lot of funding.
Digital is the way to go.
Thank you so much for that. And actually, what you were talking about when it comes to healthcare, right, is very in line with what KJ talked about. Sorry, Khairi Jamaluddin, our health minister, talked about. I think about a month ago when the health ministry launched their agenda, National Malaysia Sihat. So I think that is it's very. You seem to have a knack for timing. In 2017, when the contract workers started going, you started taking them, and then now even with your next pivot, you know exactly where to go. I'm so excited to see what Doctors on Call will come up with next. Thank you so much.
Thanks, Myra. Thanks for having me.
Yeah, thank you so much for being here. And for those of you back in the audience, this has been our conversation with Najib Hazwan, the co-founder and the chief marketing officer of Doctors on Call. That was today's interview with him on innovating the healthcare industry. If you're interested in more content like this, don't worry, we have more coming towards you. And if you are interested in the Doctors on Call application, you can go to doctorsoncall.com.my to book a consultation or for any of their other services. This has been Myra Baiti for BBTV with our guest. Thank you so much for tuning in. We will see you next time.